that happen. So we're going to have insurance companies and healthcare providers going to have great, and hospitals, great transparency. The word transparency is a very important word. So they can't get away with ripping you off any longer. It requires insurance companies to make it easy for you to compare plans. You got to be able to compare plans. You can't do that now. You're not allowed to do that. It's not even believable. I tell you what, I used to sit before I was a politician home, and I used to say, how is that possible? Things happen that, I guess it's just the forces of nature, the forces of power, and you end up with very, very badly treated people, and they won't stand for it. But these forces are going to release an earthquake of reduced price health care. You're going to have massively reduced costs. This is no longer we're going to cut it by the famous 1/8 of a point. You're going to have massively reduced health care, and it's going to be massively better. You're going to have great health care at a much lower price, which is the two things. We want great health care and we want low price. You're going to have great health care at low price. Now you have terrible health care at a high price. You have horrible, horrible Obamacare health care. Like everything else he did, it was crap. It was a horrible plan. It was from day one, and it should have never been approved. It was a very sad night that night when there was a thumb raised. Most importantly, will require any hospital or insurer who accepts Medicare or Medicaid to prominently post all prices. You're going to post your prices at their place of business, something they don't have to do, something they're not even allowed to do. We'll have the maximum price transparency, and the cost will come down just by that, not even talking about favored nations. The price will come down. So just in conclusion, I'm calling on Congress to pass this framework into law so that we can get immediate relief to the American people, including rural America. And I hope to get Democrat votes. They know, they saw it. I know a lot of Democrats. And they say that plan is unbelievable. Are you going to vote? Well, I'm going to try. They have tremendous pressure on them. Vote no. Vote no. We have a couple of Republicans. Thomas Massey always votes no. He's like, something wrong with the guy. If you have any clinical psychiatrists in there, maybe go check out his mind. But he always votes no. He's a very bad person. He's a very bad Republican, bad American when you always vote no. Just vote no. Do you approve? No. You know, there's not a thing you can say to him either, Lola. Look, Lola wants to be nice. He likes to get along with everybody. I don't. But they vote no. But so I don't know. You know, you have some people, they're very, I call him Rand Paul Jr. Rand Paul always votes. I don't know why he votes no, but I guess he thinks it's good politics. I got him elected twice. If I didn't endorse him, he wouldn't have been elected. But he doesn't reciprocate, and I guess that's okay. But I want to hear now, if I could, from Dr. Oz, and then we're going to have Dan Sullivan say a few words, and Rob and Mike, and Governor, you're going to say a few words, and we appreciate you being here very much. You're doing a fantastic job. I just want to leave by saying that this is the biggest thing to ever happen to health care in our country. It will not be covered that way by the fake news, and that's a sad thing. It will probably not be voted positively by the Democrats, and that's a sad thing. They all know how good it is. I think we can make health care into a Republican issue because the Republicans are going to be close to unanimous on this. It should be unanimous. Maybe we will be unanimous, but it'll be close. But we have a small majority. We probably need a little bit of help from the Democrats. So whatever we can do, we're going to do it. It's the biggest thing to happen to health care, maybe from the beginning. So, Oz, would you take it away, please? Thank you very much.
Mr. President. Mr. President, thank you for standing up for American health care. And I just want to underline this fundamentally important issue. We need Congress to help craft the Great America Health Care Plan. And the Great Health Care Plan will work. It's a brilliantly conceived framework. And as it comes to the American people, they understand that they'll want it. And it should represent the analogous situation, similar to what you did so brilliantly last spring with the Working Families Tax Cut legislation that the President mentioned, has created the Rural Health Transformation Fund, which is why we're here today. I want to put a little bit of texture around why this is such an important issue, because the Rural Health Transformation Fund is the largest investment ever in American history in our rural